Conjunctivitis, often referred to as pink eye, is a common condition that affects the conjunctiva, which is the thin, transparent tissue that covers the white part of the eye and also lines the inside of the eyelid. The function of the conjunctiva is to keep the eye moist and protected from debris and microorganisms. However, when this tissue becomes inflamed or irritated, it leads to conjunctivitis. The condition can affect one or both eyes and is characterized by redness, swelling, and discomfort. The term pink eye comes from the distinctive pinkish or reddish appearance of the affected eye, which happens when the blood vessels in the conjunctiva become inflamed. Conjunctivitis is a very common eye condition that affects millions of people worldwide each year. In the United States alone, it's estimated that about 6 million cases occur annually. It can affect people of all ages, from newborns to the elderly, but it's particularly common in children due to their close contact in school and daycare settings and their tendency to touch their eyes frequently. Types of conjunctivitis. There are several types of conjunctivitis, each with its own causes and characteristics. Number 1. Viral conjunctivitis. This is the most common type, and it's often the result of a virus, most commonly an adenovirus. Number 2. Bacterial conjunctivitis. This type is caused by various bacteria, including Staphylococcus aureus and Streptococcus pneumonia. Number 3. Allergic conjunctivitis. Allergic conjunctivitis occurs when the eyes react to allergens such as pollen, dust mites, pet dander, or mold. Number 4. Chemical conjunctivitis. This is a less common form of the condition and occurs when the eye comes into contact with irritants like chlorine in swimming pools or air pollution. Number 5. Giant papillary conjunctivitis. This type is often associated with contact lens wear or eye prosthesis. Causes of conjunctivitis. The causes of conjunctivitis are diverse and depend on the type of infection. Viral and bacterial conjunctivitis are both highly contagious, and they can spread primarily through direct or indirect contact with the infected eye secretions. Direct contact happens when an individual comes into physical contact with the eye discharge of someone who has conjunctivitis. This can occur in several ways. For instance, if an infected person rubs their eye and then shakes hands with someone, the virus or bacteria can transfer to the other person's hand. If the second person then touches their own eyes without washing their hands, the infection can spread. Another way is if someone with a respiratory infection coughs or sneezes close to you. This type of contact is common in close settings, such as between family members, friends, or during sports where physical contact is frequent. Indirect contact involves the transfer of the virus or bacteria from contaminated objects or surfaces. For example, if an infected person touches a surface like a doorknob, towel, or shared makeup without washing their hands, the virus or bacteria can be left behind. When another person touches that same surface and subsequently touches their eyes, they can contract conjunctivitis. This mode of transmission is particularly concerning in public or shared spaces, like schools, offices, or gyms, where many people might touch the same objects. Allergic conjunctivitis, on the other hand, is not contagious and is triggered by allergens like pollen, dust, pet dander, or mold. When these allergens come into contact with the eyes, they trigger an immune response that leads to inflammation and discomfort. Seasonal allergic conjunctivitis is particularly common and tends to flare up during pollen-heavy times of the year. In addition to infections and allergies, chemical conjunctivitis can also be caused by irritants. This includes exposure to chemicals, smoke, or even chlorine in swimming pools. Contact lens wearers can also develop conjunctivitis if lenses are not properly cleaned or if they are worn for too long. Symptoms of conjunctivitis. The symptoms of conjunctivitis can vary depending on the cause, but some common signs include redness in the white of the eye or inner eyelid, increased tear production, a gritty feeling or itching, and discharge that can be either watery or thick. Some people might also experience sensitivity to light or blurred vision. Patients often describe the feeling of conjunctivitis as having sand or grit in their eyes. The discomfort associated with conjunctivitis can vary depending on the type and severity of the condition. For instance, viral conjunctivitis often begins with a cold or respiratory infection, and symptoms may include a runny nose or cough alongside the eye irritation. The eye may feel scratchy, as though there's sand in it, and the discharge is typically thin and watery. In contrast, bacterial conjunctivitis often leads to more intense irritation, with a thicker discharge that can make it difficult to open the eyes, particularly in the morning after sleep. Allergic conjunctivitis can cause severe itching, which can be particularly bothersome for those who experience it chronically or seasonally. The itching can lead to rubbing of the eyes, which may exacerbate the symptoms and lead to further irritation. The watery discharge in allergic conjunctivitis can sometimes be confused with that of viral conjunctivitis, but the presence of other allergy symptoms, like sneezing or a runny nose, can help differentiate the two. Before we continue, if you have been finding the video helpful so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Diagnosis of conjunctivitis. Diagnosing conjunctivitis typically involves a physical examination of the eye and a review of symptoms. An eye care professional will look for characteristic signs of inflammation and may use a bright light and magnification to examine the eye closely. In some cases, particularly if the infection is severe or not responding to initial treatment, a sample of the eye discharge may be taken and sent to a lab to determine the exact cause. This can help identify the specific bacteria responsible for bacterial conjunctivitis or confirm a viral infection. If allergic conjunctivitis is suspected, a doctor may also inquire about a person's allergy history and might recommend allergy testing to identify specific triggers. Treatment for conjunctivitis. Treatment for conjunctivitis depends on its cause. Viral conjunctivitis, being caused by a virus, doesn't respond to antibiotics and typically clears up on its own within 1 to 2 weeks. Treatment focuses on relieving symptoms. This may include using artificial tears to soothe the eyes, applying cold or warm compresses, and in some cases, using antiviral medications if the infection is caused by certain viruses like herpes simplex. Bacterial conjunctivitis is typically treated with antibiotic eye drops or ointments. These medications usually start to improve symptoms within a day or two, but it's important to complete the full course of treatment as prescribed to prevent recurrence. In some cases, oral antibiotics may be necessary. For allergic conjunctivitis, treatment aims to reduce exposure to allergens and manage symptoms. This may involve using artificial tears to flush allergens from the eyes, applying cold compresses, and using antihistamine eye drops or oral antihistamines. In some cases, mast cell stabilizers or corticosteroid eye drops may be prescribed for more severe or chronic cases. Chemical conjunctivitis treatment depends on the irritant involved. The first step is usually to flush the eye thoroughly with saline solution or clean water. Further treatment may include pain relief medications, artificial tears, and in severe cases, prescription eye drops or ointments. Giant papillary conjunctivitis often requires a change in contact lens habits. This might mean switching to daily disposable lenses, improving lens hygiene, or taking a break from contact lens wear. In some cases, medicated eye drops may be prescribed to reduce inflammation. Regardless of the type of conjunctivitis, good hygiene practices are crucial to prevent spread and reinfection. This includes frequent hand washing, avoiding touching or rubbing the eyes, using clean towels and washcloths, and avoiding sharing personal items like makeup or eye drops. For infectious types of conjunctivitis, it's generally recommended to stay home from work or school until the condition improves to prevent spreading the infection to others. Contact lens wearers should typically switch to glasses until the infection clears up. In rare cases, conjunctivitis can be a sign of a more serious condition, such as uveitis, which is inflammation of the middle layer of the eye, or orbital cellulitis, which is infection of the tissues around the eye. So if symptoms are severe, persistent, or accompanied by vision changes or significant pain, seek immediate medical attention. Now, we want to hear from you. Have you ever experienced conjunctivitis? What remedies or treatments worked best for you? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.